Hi, everybody. This is Barbie Dawsey in Santa Fe, New Mexico, and thank you for taking an hour to join me today on a very exciting topic, and I want to make theory come alive for you today. And as you see on the screen right now, the theory of integrative nurse coaching, and just for a brief way to say it, you can say TINC, and I have tied in walking in Florence Nightingale's footsteps. To me, this is the exciting thing about moving this forward at this particular time. So let's look at the 5 objectives that I have for our session together. The first is we will explore Florence Nightingale's legacy. Look at those years, 1820 to 1910. Florence Nightingale died in 1910, and we are still not doing a lot of what she invited us to do. Her work is the legacy. It is the philosophical foundation for our work in 21st century nursing and healthcare, and local to global. The second one then that I'll be doing is exploring a holistic integrative professional practice model, and this is where theory fits with professional practice model. And this applies for patient family-centered care, you know, that abbreviation of PFCC in the literature, and then healing environment. I'll be examining the theory of integrative nurse coaching. There are 3 major concepts and the components. There are 5 there. And then the implications for practice, education, research, and healthcare. I also will describe the theory of integrative nurse coaching and then look at the parallel, this same model, to explore how we take this into our professional practice model. And this is the integrative nurse coach leadership component, and it is the same 3 concepts and the same 5 components. And this weaves together. Then the 5th is discuss the 17 UN Sustainable Development Goals and its relevance. So let's go forward then. As we begin, I propose that we might become what Nightingale herself was. She was a nurse, a global citizen, a health diplomat, and a nurse coach. Nightingale looked at the health and healing environments of the individual and the collective, the interior and the exterior. She pioneered statistics and health outcomes, health policy, hospital design, and environmental policy at local, national, and global levels. This is what we are called to do in nurse coaching. Not only help individuals with their change capacity to create new health behaviors, but then to look at all the bigger picture of every place that we work as nurses and tie it together, and I will be doing that in our presentation. This is what's really exciting about our work right now. 2020 is the bicentenary of Florence Nightingale's 200th birthday. That is only 2 years from now. Nightingale left us over 14,000 letters in the archives and over 200 manuscripts, and we have a philosophical foundation and literally praxis and action to move forward with our work. I know all of you have seen these word clouds, and they are very exciting, and you just look at ways to achieve a healthy world, and it's not only what we do individually, but where we live, how are we also looking at the things that we're doing to create healthy environments. And these word clouds here, these are the social and environmental determinants of health, and I will get to these at the very end with our 5th objective, looking at the Sustainable Development Goals. So what are the missing pieces in healthcare right now? And it is integrative nurse coaching is a huge one. And I think it's important for us to look at that integrative nurse coaching becomes a way that we live and practice philosophically and practically with everything that we do. So making this 2020 vision, making it a healthier world, it is about our knowing and our doing and our being. So if we look at holistic, integrative, and integral nursing, and I will tell you right now that I simply do not separate holistic or integrative or integral. It is all there together, and it's the nuances of words. But the main thing that I want to convey here is that when we are working from a holistic, integrative, and integral perspective, and I'll develop integral in a few minutes more, we are using both the science and the art. And this is the creative fire that really gets us excited so that we look at possibilities. We begin to uncover, we recover, we support, and we celebrate the creative self, not only of the nurse, but every person and community and group that we encounter. So part of this work of being a nurse coach is that we are nurse healers and artist healers, and we live our life responsive to service. And I want to say this has to be both from a spiritual and a practical. I'll just define spiritual in just a few minutes. And when we do this, we're able to really navigate in a new way all the chaos, all the complexity in the work that we do and connect the dots. So integrative nurse coaching is about our presence, compassion, and healing, how we truly enact our knowing, doing, and being. So let's first look at the integrative practice model. And this is what is important, is when we use a professional practice model, nurse coaching is the piece that puts all of this together. So looking at the integrative nurse coach practice model, clinical practice. The second part of that then is performance practice. And the third then is management practice. So this is where integrative nurse coaching comes in. If we look at these three components, rather than doing it the same old way, top-down, people telling us what to do, what happens when we take an integrative approach and we teach and perform to the standard from a coaching perspective? Then we also go from performance. We perform to the standard from an integrative nurse coach lens. And then we manage, rather than telling people what to do, trying to solve all the problems as a manager, we manage to the standard with a coaching approach. It is absolutely thrilling. All the pieces are here. So let's begin to make the theory of integrative nurse coaching come alive. And I want to tell you how I got started with this, with two other colleagues, Susan Luck and Bonnie Galino-Schaub. Back in 2010, we began to have the conversation that was really important. If we believe that nurse coaching was to move forward, what are the pieces that we needed so that nurses could approach coaching not from just external change theories in other disciplines, but how could we approach it through our lens to then connect to interprofessional dialogue? And this is how we began. So what we explored, and it took us 5 years before it was published, we realized that what we could do and had the capacity to do in order to move the profession forward is to create a mid-range theory. Mid-range theory, it's called mid-range because it focuses on a specific nursing phenomenon, and this one is integrative nurse coaching. And then a mid-range theory offers the bridge between grand nursing theories that encompass most global phenomena in nursing discipline. And also, a mid-range theory is broad enough to be useful in complex situations. And also, it leads to instrument development and theory testing through research and nursing practice. And one of the other aspects of this is we did create an integrative health and wellness assessment tool that has been validated, and it can be accessed through the Journal of Holistic Nursing online journal that came out last year. So let's look at the steps that you do in a theory. It's very exciting. Well, how do you pull all of this information together? And then you have to really hone it down, and you look at what is the purpose. This is the aim of the theory. So what we wanted to do was we wanted to demonstrate the unique integrative nurse coach role and competencies for health and wellness. We want to explore the direct application of integrative nurse coaching in all health community settings and interprofessional collaboration. And then we wanted to expand integrative nurse coaches' capacities as 21st century nightingales and health diplomats who are coaching for health and wellness, local to global. So, in developing theory, then we had to really begin to hone it down and ask the questions. What will we have in this mid-range theory? So the question one that we began to ask is, what are the implications and the relevance of integrative nurse coaching to healing? So when we have a holistic, integrative, integral nursing, healing is a major foundational part of that. We have to look at the meta paradigm in nursing theory. I'll break all of these down in a few minutes. We had to look at the pattern of knowing in nursing. We had to look at nurse coach self-development. We also wanted to look at that integral perspective from our own interior to my actions in the world, to our collective we. Like right now, we're sitting in this we space, even though we can't see each other. I know your energy's on the other end of this line, and we'll get to talk at the end of this. Then the other thing that we had to do in this series is to look at awareness and choice. Where does this fit, and how will it be seen in a mid-range theory? Then to look at the threads of energy, resilience, and transformation that are absolutely critical in the change process. So the second question we had to ask then is, which of the existing nursing paradigms and worldviews most closely explains integrative nurse coaching? And you all know that in nursing theory, we have three major paradigms. And of these three, you can see on this image that the gold highlight there, the integrative interactive paradigm. This is where my colleagues and I felt that this is where this mid-range theory fit best. Yes, there are parts of the integrative transformative paradigm that are within this, as well as caring theories paradigm, but the largest encompassing is the integrative interactive paradigm. Now, the third question that we had to ask then, what are the substantive domains of health and wellness coaching knowledge, qualities and competencies as seen through a nurse coach lens? And man, when we were able to answer those, we were off to the races, as they say. So I want to start with one key point here, and that is the nurse coach self-development. We believe clearly that in order to do integrative nurse coaching, the nurse coach parallel process is there as we are with clients and patients in their change process, with communities and groups, families, whoever, even our colleagues at work. So a key piece of this model is the integrative nurse coach self-development. And the image that you're seeing here, I love using the analogy. How do we get a therapeutic level of medication in our body? We take it on schedule. How then do you and I get a therapeutic level of caring for ourselves every single day? Not maybe once an hour on the weekend. Moment by moment, how are we mindful? We put ourselves on our own calendar every single day. Another part of this journey of nurse coach self-development is we have to look at our own healing. And I have a friend, Cynthia Smith-Seabolt, and she paints angels. I love this one. It's called The Wounded Angel. And as you see in the center, there is a wounded one. But on either side, you see there are two others that are there to listen to the wounded one's story. And so I say to you right now, who is a soulmate for you that loves you unconditionally, so that when you think you're going crazy and you want to be doing something and you believe it so much, but you know people aren't going to go along with it, you have to tell the truth to yourself. And who is a like-minded colleague who can join you, who will listen to you and will listen to your story and won't tell you what to do? This is the integrative nurse coaching process. Presence is key in integrative nurse coaching. How do you know when you're in the present moment? And how do you know when you're in a present moment with a client and a patient? One of the things that always helps me when I know I'm there, it's like I get spirit bumps. There is an energy, there is a feeling that just, I can feel it inside, and in deeper spaces when it happens, it's like the hairs on my arms stand up. It is so present to listening. It's when we put aside our own story, we park it in the parking lot, as we say, and we're listening and we're catching the threads of the patient's story so deeply and in a rich way. You and I, as nurse coaches, have to be able to alter our perception of time. Alter our perception of time to go deep into our caring and healing. And as we advance our capacities to go into this deeper space of healing, we too will be able to journey much deeper with clients and their caring and healing. If we're not doing our own inner work, our coaching is going to be very superficial. It's going to be rapid, and it moves into a telling people what to do, and that's not what coaching is about. Intention is everything in integrative nurse coaching. So all of the skills that we have learned in holistic and integrative and integral nursing come to play. And it is right now your intention is to learn a bit about the theory of integrative nurse coaching and how to move it forward in your work. I want to say a little bit about spiritual meaning and its correlates, because this is very important. A lot of people skirt around spirituality, and this is the longing that people have right now. People are feeling a lot of disconnect from the chaos we have in our environments, local to global, in the politics, and the unpredictability of so many things. And when people can tap into their spirituality, this is that sense of connectedness, connecting with something that is higher and greater than the individual self or ego. And it's that certainty that meaning and purpose and direction are valid aspects. So when I sit quietly and I like to begin my day, I find it works much better for me if I can sit for 20 or 30 minutes and, again, adjust my day depending on what I need to go and how quickly I need to get started. There's something that allows me to anchor that moment in time, that 20 or 30 minutes, to be quiet. And then during the day when I get hassled or rushed or frustrated, I can take a deep breath. I can maybe touch my chest, which is a way that I anchor getting back to that place of knowing what it feels like to be calm and quiet. And I connect to my spirit to go to the next level. I also want to say religion is important. Everybody has their way of doing this. Religion, by definition, is a codified system of beliefs, rituals, and behaviors that may or may not involve a sense of the spiritual. And they usually involve a community of like-minded believers. So people can be spiritual and religious. They can be spiritual or religious, or they can be spiritual. Everybody has their way of defining this. But it behooves all of us to enter into asking these curious questions where we can access people's beliefs to help them make the deeper connections that will work. So health depends largely on awareness, choice, and intention. And we know in conventional medicine that patient-centered care is often neglected in favor of the physically based factors, the physiology, the anatomy, the genetics, the epigenetics. And oh boy, are we going to be start hearing a lot about genetics and epigenetics. But just because you've identified what your SNPs are or whatever, if you want to say stop any kind of disease progression or any of that manifesting, it's going to take change process. And this is where our integrative nurse coaching comes in. So we're more than our physical beings, and we will continue to give almost everything over to traditional mainstream medicine and the physical care as we're doing currently, unless we factor in choices and intention. And this is lifestyle health. So nurse coaching, it really helps us shift our consciousness so that any given time we're aware of body, mind, spirit, cultural, and environment and all of the choices that we make. Because it's when we become aware of what we're eating, what leads to stress, then we can make a choice to shift and turn that around. So this Integrative Nurse Coach partnership is truly about connecting to the story of the client and also connecting to our own story, connecting to the story of the family members and the significant others, and also all the people on the collaborative healthcare team. And as always, it seems like the nurse frequently is the one that ties all of these pieces together, all the different healthcare. This is a tool that I mentioned earlier when I started Integrative Health and Wellness Assessment. And one of the things that we looked at is if we're going to do a mid-range theory, it is also crucial that we have a tool through a nursing lens that can help us with lifestyle change and behavior. And again, if you want to look at the validation of this tool, the Integrative Health and Wellness Assessment, the title of that in the Journal of Holistic Nursing Online, it was Instrument Development of Integrative Health and Wellness Assessment, and Deborah McGillicuddy is the lead author on that. And it will, you will find it a very exciting read. about all the research there. So let's make this come alive. And as we begin to make the theory of integrative nurse coaching come alive, let's start with healing. What is healing? Think about your own definition of healing. I see healing as a lifelong journey. It's opening what we've closed down. It's remembering the way and the things that have worked for us, our rituals of healing and the people in our life, and how to move forward. Healing is something that we are born with. Nobody can take it away from us. And it is possible until the last breath that we take. Curing and healing may go together. Curing is the removal of symptoms. Even if symptoms cannot be removed and a person is moving toward dying, that great gift, healing, can come with the last breath. And we have many colleagues now that are moving into end-of-life care with their coaching. The next then is this meta-paradigm in nursing. And every one of y'all know this. This meta-paradigm are 4 areas: nurse, health, environment, and the person. So nurse and person. Person can be the patient, the client, the family, interprofessional colleagues, your family, groups. Health is defined by how the person believes it to be. There are many different definitions of health, but you want to access what does that person believe that health means to them. And in this meta-paradigm, environment is both internal and external, but it also reflects society at large. So that's our meta-paradigm. Then these patterns of knowing are very, very rich. And this is the beauty of nursing, because we do all of these at any given time, and we can concentrate on any of them individually: the personal, the empirics, the aesthetics, the ethics, and the not knowing, and the sociopolitical. The most important thing here, I think, of all of these is when we look at integrative nurse coaching, this is key, that you and I must be willing to ask questions and have no fixed idea about what the right answer is. We have to give up knowing what is right for another person. We work with them and we co-create and come up with a creative plan with them that is something that they can move with, that will help them change their lifestyle to be healthy. So let's look at these 5 components then. The first component is the Integrative Nurse Coach self-development. And you will see in the mid-range theory of integrative nurse coaching that we have 4 areas there: self-reflection, self-assessment, self-evaluation, and self-care. Frequently what happens, we just say, oh, I've got to do that external stuff. I've got to eat right. I've got to go exercise. Oh, I need to take a few deep breaths. Let's go back and let's start with self-reflection. Really taking a breath and from a reflective space. Just to ask, what am I most in need of healing of right now? And then to assess, what am I doing to help me with that? And then evaluate what you're doing, and then that will help you go to that deeper level then of self-care. Yes, they're all working at the same time, but remember that place of self-reflection that is absolutely so key. Then looking at the integral perspective and change. And this is looking at our interior, individual state of being, and then our external actions, and our collective interior, like we right now are in this collective space. I'm going to get to this a little bit later. And then our exterior, how do we work together to make the changes? The third then is the integrative lifestyle health and well-being, and you will clearly see that when you read about the theory later and look at this PowerPoint in relationship to quite a few articles. And then looking at awareness and choice. And then the 5th component there is listening with heart. So you have healing in all of these 5 components. And then around all of this are energy fields around each of these individually and together. And this is the internal and external environment. You change anything in one quadrant, and it will change all of the other. So let's put this together then. The healing, the meta-paradigm, the patterns of knowing, those 5 components, and the energy field and the internal and external healing environment. So let's break a little bit of this down and look at healing. And let's look at these integral perspective, and let's look at this upper left. This is my meaning. And I want to just go through briefly the 4 quadrants, and then we will come back to putting it all together. Then the upper right is my external bodies and actions. How do I walk in the world? How do I eat healthy? How do I exercise? How do I take my breaks? The lower left end, this is our shared meaning in our relationship. How do we come together to share what we believe to be true? And let's look about integrative nurse coaching in our work and our professional practice model, wherever it is that we work. And then the external lower right is the group, the process, the structure, and the system. So let's now put a few more words to these and see what is going to happen when we develop this. So let's once again go to this upper left and look at my meaning, and let's start with healing. And this is a little bit more about this meaning. This is about your state of being, your state of higher self, your inner world, what matters to you, your thoughts and feelings, your values, your intention, your meaning, your shifts in consciousness. How do you shift from getting out of your rigid patterns of thinking to spend time with yourself, to have a new approach, a novel experience? And also what's really important here, when you look at my meaning, you can share your meaning with others when you choose. Absolutely key. My meaning is about your state of being. Let's look over here at the upper right. This is, how do you walk in the world? What are your tangible and measurable parts of you, your behaviors, your doing? That's your body and your action in the world. And what's so critical about this is when you can identify from a quiet space, like, I want to eat healthy today. I want to have 3 green vegetables. You're talking to yourself about your inner state. How can you be healthier? So if you look at body in action, this requires that I either go to the icebox, and right now I don't have any greens in my icebox, so that means that I need to go to the grocery store before dinner to take 45 minutes and go play at the grocery store and buy some green vegetables and some fruits in season so that I will eat healthily with high energy. Now let's go to the lower left end. This is our shared meaning and relationships. What's exciting about this? This is our collective intelligences. So when we come together, and we're not just always identifying, the problems that are going on, but what's going right here, and how can we, with our collective intelligence, work together and then have a dialogue about our culture, and through our dialogue, our conversation, we can mutually understand and relate to each other about bringing something new into the environmental space. And let's say it would be integrative nurse coaching. And from a shared space, a collective we are different on the unit with our colleagues, how we manage with patients, and so forth. Now let's go over to the lower right. This is a group, the process, the systems, and the structures. So what's exciting about this is where we take our accumulative, our collective shared knowledge, and we now have an external game plan action of how we're going to do some things in the external environment differently. The design of things, how we think it can work better. We will increase the aesthetics, the process, the procedures of the system, the structure, and explain, support, and map, measure, guide, all of those things that are going to make this beautiful healthcare system work better. We all know what we've got right now is a very sad system, and can you imagine what it would be like if they would just turn it over to nurses? Oh, my gosh, we could solve the healthcare challenges in our country, couldn't we? And also globally with that coaching process. So look, put all this together. Do you see how it is? And the most important thing about this integral perspective, you cannot leave any one quadrant out. The quadrant that always, most often gets left out is this upper left. And the next one that's usually left out is the body and actions on the right. I also want to say that in another model, I just try to keep this simple here, but our medical model is this upper right quadrant. It is about physiology, pathophys, protocols, medicine. That's where all of the focus is that external upper right and external right. We use the words patient-centered care, professional practice model, but frequently the areas that are left out is this on the left side, the individual interior and the collective interior over on the right. All right, let's look then at the 4 quadrants and lines of development. This is really key from an integral perspective, is how do we begin to truly develop our lines of development? The spiritual, moral, interpersonal, somatic, getting a felt sense, emotional, and cognitive. And this is about our I space, developing that. Then looking at the we, how do we, once again, these same different lines of development. We have to do all of these. We also have to do all of these lines of development in our external. And this is our individual. What are my actions in the world? How am I treating my colleagues? What are the words that come out of my mouth? How am I able to move and be aware of my individual lines of development so that then my individual external lines of development come together when you and I come together to increase this integrative nurse coach model in the work in the world. Very, very, very exciting. Okay, so as you see from the top here, the theory of integrative nurse coaching, the TINC, and the integrative nurse coach leadership model components are the same. It is how we live into this theory, how we live into this professional practice model, and we bring this into everything it is that we do. Integrative nurse coaching is not a tack-on role, but it becomes who it is that we are. I want to spend just a moment looking at the American Nurses Association Healthy Nurse, Healthy Nation, and they started their grand challenge in 2017. I'm thrilled to say that I've been on this advisory board now since 2015. Our American Holistic Nurses Association is a champion partner with this area. And this is what is very exciting about the integrative nurse coach role right now, is because as ANA is looking at nurses are not healthy, and they really are saying if nurses can increase their capacity in these 5 domains of safety, rest, quality of life, physical activity, and nutrition, oh my heavens, and then they start making changes in their life, then they're going to have a different way of relating to patients and helping them make the changes in their life. So I really encourage you to go to ANA, Healthy Nurse, Healthy Nation, look at all the tools, and there's so many things that they have that are brand new weekly. It is gorgeous, so go to that site. I mentioned as the last objective that I wanted to present was to look at the United Nations 17 Sustainable Development Goals. These are absolutely critical for transforming the health of the world. This is what makes me so happy every day. When I get frustrated and think that nothing's going to change, and when I think that 193 member states of the UN, this is their mandate. We in the United States also, we are looking this in our country. And right now you can go at, as you see, this agenda goes out to 2030. And in the United States right now, our healthy nation has gone out to 2030 with agenda looking at all of these pieces. Look at number 3, good health and well-being. That has got nursing written all over it. And then you look at all of these. So this is our challenge, is to be aware of how we relate to each one of these. And one of the things that I find is be aware of just focusing on one of these and then always relate it back to good health and well-being. So, for example, here in New Mexico, it's like, are we going to keep the food program for school kids going? How can a child learn if he or she has not had a healthy meal during that time at school? So do you see how, 2, zero hunger, that we strive for that. But if a child is hungry, look at number 4. Do you see how they're connected? If a child has not had a meal, how can he learn anything? He or she learn anything? So be aware of these Sustainable Development Goals. They are in your mandate, and it's your contract with society. When you say, I am a nurse, you are showing up with your meta paradigm of nursing, with your patterns of knowing and not knowing, and putting all of these pieces together. So really be aware of this good health and well-being, because all of this is wrapped into the social, culture, and environmental determinants of health, which are part of our theory of integrative nurse coaching. It is truly an honor to be a founding member of the American Holistic Nurses Association, and I am thrilled to say that the American Holistic Nurse Credentialing Corporation has partnered with all of us in holistic nursing, and they now have a nurse coach certification process and also a holistic nursing certification process. And you see the HNCC logo here. So go visit this very robust website and learn more about becoming certified as a nurse coach and a holistic nurse. I also want to say a couple of publications that you can look at: The Art and Science of Nurse Coaching, The Provider's Guide to Scope and Competencies. This is now in the process of being revised. It is available through ANA or on Amazon. A textbook that I have co-authored that the theory of integrative nurse coaching is expanded in this, plus many other areas of nurse coaching that you can explore. And I want to say thank you, and I will stop for right now and invite Stephanie, I guess everybody people to unmute only if you want to ask a question, I guess. Thank you for joining me today.